Between Tuesday, May 2nd and Monday, May 9th, our PCR test positivity rate ranged from 16.8% to 26.1%, with an average of 20.7% for the week. As the Minister mentioned, the number of people in hospital with COVID-19 decreased from the previous week. Currently, there are 1,225 people in hospital with COVID-19, including 37 in the ICU. Sadly, between May 3rd and May 9th, 70 deaths related to COVID-19 were reported to Alberta Health, with an average of 10 per day. My condolences go to the loved ones of these Albertans and to anyone who has lost someone they cared about, no matter the cause. What we've seen in previous waves is that the first indicators that start to decline are the leading indicators that are looking at cases. So from what we're currently monitoring, wastewater positivity trends typically are the first thing to fall, followed by hospitalization numbers. That typically starts to decline next, and deaths usually is one of the latest indicators both to rise and then to fall. So I would not expect us to see this high level of deaths continue. I would expect that this is that final late indicator showing the impact of the BA2 surge, and that as we're seeing some of those other indicators start to turn downwards, that we would expect to see the same thing in our number of deaths. Having said that, as I mentioned earlier, it's important to know that COVID will remain with us in kind of various waves. We should expect that it will return potentially in the fall with other respiratory viruses. And these deaths are a reminder that it is a very serious disease for many people, and the importance of having all doses of vaccine that people are eligible for, to make sure that people have as many layers of protection as possible against those severe outcomes.
For those still at higher risk, we continue to look for any new tool that can help, and that includes looking closely at how we make the best use of Paxlovid. To date, over 2,000 prescriptions have been provided, and our supply sits at nearly 30,000. Paxlovid is not the right choice for everyone. Its use is based on expert judgment of the balance of benefits and risks for different groups of patients. Our experts have looked at Alberta's data, which shows an increase in hospitalization risk for older Albertans with certain conditions, regardless of their vaccination status. Those conditions include diabetes, obesity, chronic kidney disease, congestive heart failure, COPD, and moderate to severe asthma. Based on this review, I'm pleased to announce that we're expanding eligibility for Paxlovid. Starting today, it will include people age 60 and over and First Nations people age 50 and over with 2 or fewer doses of COVID-19 vaccine and at least one pre-existing condition, and people age 70 and over and First Nations people age 60 and over with 3 or fewer doses of vaccine and 2 or more pre-existing conditions. Now, that's in addition to the people who are currently eligible. That's immune-compromised Albertans and all those living in continuing care, regardless of their vaccination status.